Good afternoon. A warm welcome to all of you for this session on basic life support. So before I start the topic proper, I would like to introduce myself. I'm Dr. Chandra Sekhar. I'm a senior consultant critical care at KIMS-Saveera Hospital, Anantapur. Basic life support, being a lifesaver. This is one of the most important gift that God has given medical fraternity to save a life. So the same way, we all, including the medical fraternity and even the common public, there should be an essential skill which should be learned by everyone. And that skill is nothing but the basic life support. So, what basically it means, what is basic life support? So, basic life support, as you all know, is nothing but it is a type of care that is usually provided by the healthcare providers or anybody who are the first responder to a patient. Suppose you see somebody lying on the road, or you see somebody suddenly collapsing in a mall, or any place. So it is the people who respond to them first are called the first responders. So, and the public safety professionals, the professionals like the associated healthcare workers, somebody like the people associated with healthcare. So everybody comes under the public safety professionals. So the anybody can provide this to a patient who is experiencing cardiac arrest, respiratory distress, or any obstruction in the airway. So basically, the guidelines that we follow are the American Heart Association guidelines. They keep updating every fourth yearly. So the latest guidelines that we have are from the American Heart Association 2020. So when we talk about basic life support, there is another term which we all should know. So I don't want to confuse everybody too much. So I won't go too much into the adult cardiac life support. So basically, the adult cardiac life support and basic life support are two different entities. When it comes to basic life support, as I've already mentioned, basic life support is some skill which should be learned by everyone. Whereas an adult cardiac life support, it is specifically to the medical personnel, and it requires specialized training along with the use of we have to know how to use the medications and how to administer the shock. When it comes to basic life support, it is all like an automated thing where we have the American Heart Association 2020 algorithm. So we have to follow the algorithm, as well as we have to learn which is the proper way to do it. So what are the steps in basic life support? So before we start the algorithm, I would like to just mention the technical term CPR. So CPR is nothing but cardiopulmonary resuscitation. So it basically involves a hands-on emergency intervention to restore the heartbeat and breathing. So if somebody goes into the cardiac arrest, you have to the two main things that are getting arrested here are cardiac and pulmonary. Cardio is nothing but it means heart, and pulmonary is nothing but your lungs. So if you either your heart stops or your breathing stops, then you start resuscitation. Resuscitation is trying to revive. So the term CPR basically means cardiac pulmonary resuscitation. So you're reviving the heart as well as the lung. So, and hands-on, because you have to first try to awake the patient, then you have to perform the chest compressions, and you also have to take care of his airway and breathing. So this is one important algorithm that everybody should have in their mobile. This is you need not remember it. If you don't remember it, always try to get an updated version of this and try to keep it in your mobile, because this can save a life. And as you all know, when it comes to an emergency, time is life. So the earlier you get the patient, the earlier you start doing the chest compressions, the better the recovery will be. There are worldwide census of people who have survived CPR and who have come into life. So it is not only the person who is involved, but it is his entire family that you are saving. So my request to everybody would be to take a note of this. You can just press the American Heart Association algorithm, BLS algorithm, and this one is the latest one, that is 2020. So I want you to keenly follow me with regards to this algorithm. So I'll be just going from the first point of the algorithm till the last. So just stay with me, then I'll let you know how to do the chest compressions and how to perform the how to use the AED. So verifying scene safety. So before we actually jump into resuscitating the patient, I'll be using the term resuscitation because, as I told, resuscitation is nothing but trying to revive. So first thing that we have to do is verify scene safety. So if we are in the middle of a road and somebody collapses because of a road traffic accident, or somebody collapses because of acute heart attack, we should not immediately go and start CPR in the middle of the road. So verify scene safety is nothing but you have to get the patient and yourself to a place where you feel it is safe and secure. Uh, Instances like a building catching a fire, or there is a earthquake, or there is a road traffic accident. You have to first verify the scene safety and make sure that your safety is also important. Then next thing we have to do is we have to check for responsiveness. So what do you, because you don't know the person, you can just address him sir, madam, or any other thing, and you can try to wake him up. Then shout for nearby help. In India, definitely you get a lot of people for help unless and until you're in a very remote area. So try to take somebody's help and activate the emergency response system. This is nothing but the 108, which we regularly call during an emergency. So you have to call 108 with a mobile device. You can call through your mobile device, or in case you don't have the person lying down, you can just press the emergency and dial 108. And in case you're in a mall, or in case you're in a place where you have an access to an AED. AED is an automated external defibrillator. Usually big malls, or the hospitals, or any other areas like the railway station or the public places, usually will have a dedicated place for an automated external defibrillator. So try to check, or try to ask the other person who has come for your for your help, to go and get the AED as early as possible. Then the algorithm divides into three things. First is you try to look for his breathing and pulse. So how do you assess the pulse? Pulse is something which we have to keep our three fingers, and the pulse that we are checking here is called the carotid pulse. So how do we check the carotid pulse? We take three of our fingers and try to put it just next to our midline, where we have the thyroid and the cricoid cartilages. Just try to roll your fingers beside. In case you are a newcomer and you find it difficult to locate the pulse, you can keep it like this. Like this, try to see if any of your fingers can feel the carotid pulse. So when you are doing this carotid pulse check, always make sure that you do a carotid pulse check for not more than 10 seconds. So other thing, how do you see for breathing? Breathing, you just sit beside the patient and just see if the patient's chest is moving up or not. So if his chest is moving up, then you can consider that he is breathing. If his chest is not moving up, you can consider that he is not breathing. So now, as I have told, the algorithm divides into two. First thing is, if it's normal breathing and normal pulse, what you can see to your right. So just, you have already called the 108. So just wait for them to come, and the healthcare workers to take over from there. Suppose in case the patient is, let us turn to the left side of the algorithm first. So the patient has no normal breathing, but his pulse is felt. So you have seen the chest is not moving, but his pulse is felt. So what do? You take an ambu mission. In case you have an ambu mission, so ambu bag. So take the ambu bag, just put it on the patient's face and try to provide rescue breaths. So how do you provide the rescue breaths? You have to provide one breath every 6 seconds, or 10 breaths in a minute. And then you have to keep checking for pulse every 2 minutes. So there has been a lot of discussion about use of mouth to mouth respiration, providing mouth to mouth respiration. Yes, of course, if the patient is known to you and is your relative, or you are secure with the patient, yes, you can always provide mouth to mouth. But if it's unknown patient or an unknown person, AHA recommends against use of mouth to mouth respiration. So the better thing would be to fetch the ambu bag, or wait for medical help. So in case there is no breathing or gasping breaths, and the pulse is not felt. What is gasping breaths? Gasping breaths is the last tiny breaths that the patient takes, something like So those breaths, if they are found, it's considered as no breath, because there won't be any chest lift when the patient is gasping. So it's only the movement of his head or the movement of his lips. So either if that is there or if there is no pulse, then you consider starting the CPR immediately. So how do you start the CPR? We start the CPR by performing the chest compressions. So there was a lot of discussion regarding whether to start the chest compression first or to check the airway. But it is now proven beyond doubt that chest compressions can save anybody. So what do these chest compressions do? So if you 1 second, I'll just go to the next slide. So what do these chest compressions do? So the middle bone that you are seeing is called the breastbone. We can all feel it on ourselves. So the breastbone, and you can see the underlying, the heart underlying this. So when you see the heart underlying this, when you are compressing, as we have seen in the earlier picture, when we are compressing with the palm, so we are providing an artificial circulation inside. We are creating a phase where we are artificially circulating the blood inside. So that is the reason why the chest compressions have been given the topmost priority. And there are certain ways to do the chest compressions. So it is called high quality chest compressions. So the ratios of chest compressions to breathing is 30:2. So how do you do the chest compressions? So this, as I've told, this is the most significant part of the CPR. So one should know how to perform proper chest compressions. So if we can do a proper chest compressions, I think we'll be able to, 70% fulfill our job of making the patient survive till the healthcare workers arrive. So 5 things to remember when we are doing chest compressions is always push hard and push fast. You have to place your palm correctly. So this is how we place our heel of the palm. So the middle bone is called the breastbone or the sternum. So we try to put our hands just into the lower half. Suppose we make the sternum or the breastbone into three halves. We try to put the heel of our palm on the third half. So we try to put it over there so that the compressions are directly have an impact on the heart. So try to keep your hands, your elbows, and the shoulders in straight line, and try to push as hard and as fast as possible. So compressions at a rate of 100 to 120 per minute. So in a minute, if you calculate, your chest compressions should be at least 100 and to a maximum of 120. And chest compression depth is 2 to 2.4 inches, which corresponds to 5 to 6 centimeters. And you should allow a complete chest recoil. So when you're pressing from the top, always ensure that there is adequate and complete recoil before you start the next compression. And you should always minimize the interruptions. So if you have another rescuer with you, so once you finish 2 minutes, it's always better that the next person takes over. And if you're a single person, you don't have an option but to provide chest compressions till the medical help arrives. So this is another picture showing the high quality chest compressions, where we keep the heel of our palm on the sternal bone, as I've told. So keep pressing down. So chest compression fraction is more than 80%. So what does this chest compression fraction mean? Chest compression fraction means you have to prioritize the chest compressions over breathing. So if you were to take chest compressions and breathing in a ratio, always chest compression should be more than 80% of the CPR, and your breathing should be only 20% of the CPR. And as I've already told, because these points are very important, I'm repeating it again. The compression rate is always minimum of 100 to 120 per minute, and the compression depth of 2 to 2.4 centimeters, or 2 to 2.4 inches, sorry, or 5 to 6 centimeters. And when it comes to children, it is 1/3 of their chest measurement. So I'm sticking myself to the adult one today. So for all purposes, remember the number 2 inches to 2.4 inches. So we should allow complete chest recoil and avoid excessive ventilation. So only after we provide 30 breaths, 30 chest compressions, sorry, we have to provide 2 breaths. So how do we provide breaths? So this is a mission called an AMBO. It's an artificial manual breathing unit. So this mission, as we can see, this AMBO mask will be usually available at most of the emergency kits or the first aid kits. So this is one of the most important emergency equipment. So we hold, there will be a mask along with it. In case the mask is readily available, you can attach the mask to it and immediately place it on the patient's face. So when we are doing, there are certain maneuvers called the triple maneuvers. So we have to extend the patient's necks, we have to do a chin lift and a jaw thrust, and then we have to apply the face mask tightly sealed. In case we find it difficult with one hand, we have to always use the second hand, and we have to provide 2 breaths after every 30 chest compressions. So let us once go back to our. So in the meantime, once the AED arrives, your automated external defibrillator. So you just connect the AED to the patient. So this is how an AED looks. So on the AED itself, there will be 2 paddles. There'll be labels on the paddles as to where we have to place it, because this machine is completely automated. We just have to follow the instructions like how we do in our mobile when we are updating or something. So just follow the instructions as mentioned in the AED. So there will be 2 paddles along with, once you remove the stickers of the paddles, you can just stick it to the patient. One at the apex, and the other one just next to the sternum on the right side. So you can place them, and there'll be then the machine will automatically read the rhythm, whether it's shockable or a non-shockable rhythm. So if it's a shockable rhythm, then you have to just press the shock button. So before you press the shock button, you have to always ensure that you are not in direct contact with the patient, because you are passing some electric shock through the patient to make his heart function again. So we should ensure that you're not touching the patient or in contact with any of the surfaces that the patient is sharing, if they are good conductors. So ensure that you or your other helper is not in contact with the patient. So once you move, if it's a shockable rhythm, just press the button shock, and the machine will automatically give a shock. So in an AED always is more like an interactive, because it keeps telling that once you connect the paddles, it will keep telling what it does. Like it will keep telling, assessing the rhythm, shockable rhythm or a non-shockable rhythm. So if it's a shockable rhythm, once you press the button, it will again give you an instruction to move away. So in case you are doing it for the first time and you forget certain things, at least ensure that you're keeping your ear on what the AED is giving us. So once we shock, then we immediately resume the CPR. So what we should not do is we should not shock and then wait to check the pulse and all. So always remember, in a BLS or for that matter even in ACLS algorithm, checking the pulse and the rhythm are only after 2 minutes. So once you deliver a shock, continue your chest compressions at 30:2 and the characteristics that I have already mentioned. So once it's 2 minutes again, check the pulse. So if it's a non-shockable rhythm, once the machine says it's non-shockable, then continue the CPR. Excuse me. Then continue the CPR and keep checking pulse every 2 minutes. So how long do you do it? You have to do it either till the patient is awake or your medical help arrives. You're in some place where the medical help doesn't arrive. I don't think the patient is lucky enough. But if you are in a place where you can get adequate medical help within half an hour, then probably you should continue the CPR till then. So This is a simple algorithm that actually probably this is the smallest one page that can save so many lives. But the thing is, we should know along with this, we should know which is a proper way of doing chest compressions, proper way of applying AED, and proper way of using a mask. So just to sum up, I would like to go through the algorithm again before we finish. And since this is an important topic, I would like to take this again in with a demo class along with my colleagues and my medical fraternity. So I would be doing another session of this with a live demo in which I would like to show you how to hold the mask and how to do a proper neck extension, how to see for chest rise. So before we close, I would like to sum up again. So the first thing that all of us should know in BLS is the doing a proper chest compression, a cardiopulmonary resuscitation. So how do we start? We started with verifying the scene safety. So once we are sure that the scene is safe, we start by checking the responsiveness. Then you can shout for nearby help. Then we activate the emergency response system by calling 108, or if you have any other hospital numbers nearby, you can always call that hospital or the ambulance number. And you have to try to get and fetch an AED, automatic external defibrillator, or somebody else who's assisting you to do that. Then check for pulse and breathing. Pulse, how do you check it? Again, put your three fingers just lateral to your midline. Check if you can feel any pulse. That pulse is called the carotid pulse. So if you can, you have to minimize and check within 10 seconds. So once you're sure that there is no pulse, then you have to check for breathing. And if you don't see any chest rise, then go to the straight part of the algorithm by starting the CPR. If you feel the pulse and you can see the breathing, then wait till the emergency team arrives. Suppose you don't have, the patient is not breathing normally, but the pulse is felt, try to provide rescue breaths. If it's a known person, you can do a mouth to mouth with the rescue breaths at one breath every 6 seconds or 10 breaths per minute. And you have to check the pulse every 2 minutes. So in case there is nothing, he doesn't have a pulse or he doesn't have breathing, then you can start CPR. So CPR basically is cardiopulmonary resuscitation. So we perform chest compressions to breathing at the ratio of 30:2, and we have to get the AED as soon as possible. So the moment the AED arrives, we can immediately give a break to the CPR, immediately connect the automated external defibrillator. So once the automated external defibrillator is connected, so the automated external defibrillator will have its own voicing by which and sensing by which it will tell you the rhythm. If it's a shockable rhythm, then we press the button, shock. We try to move a little away from the patient, try not to be in contact. Then after that, resume CPR immediately after giving a shock. Then the machine will say shock delivered. So after that, resume CPR. Then again 2 minutes, check the carotid pulse and check the breathing. And after 2 minutes, the machine you can press for assessing the rhythm. It will assess the rhythm and it will say whether the rhythm is shockable or non-shockable. So throughout this CPR, you get not only suppose the first rhythm is shockable, not necessarily that the next rhythm after 2 minutes is shockable. So always every 2 minutes, see whether the rhythm is shockable or the non-shockable. If it's shockable, then press shock, provide chest compressions, and then check after 2 minutes. If it's non-shockable, continue with your chest compressions. Then after 2 minutes, again check if the rhythm can be shocked or not. So by this, the last question, how long do we do? As I've already mentioned, we always do till the medical fraternity arrives. So this is the right placement where we keep the heel of our palm on the lower third of the sternum. And so this is what it does. It basically functions like we are doing the function of the heart from outside. Function of the heart is basically pumping the blood. So when we are giving good chest compressions, we are providing the circulation internally. So this is the AMBU bag. So it is nothing but the full form is artificial manual breathing unit. So we should know how to use it. So in my next demo, I would be demonstrating how would we do it. And this is the AED. And next time I request all of you, when you're walking through a mall or when you're walking through an airport or a bus stand or even railway stations, always try to make out where these things are kept, because this is one thing which always guides you with the proper CPR. So with this, I would like to thank everybody who joined, and as I've asked, I request all of you to download this particular algorithm. You can just press Basic Life Support 2020 American Heart Association. So you can download this and keep it in your mobiles. And when you see or encounter a patient, always be alert with this algorithm, because you can join us in saving lives. This is the best way to join the medical fraternity or helping the medical fraternity in saving lives. So thank you all again. Hope I will join you soon with the demo session.